Okay, module 44, psychological aspects of illness and well-being. And there's one question we're going to answer in this module, and that's looking at, how do psychological factors affect health-related problems such as coronary heart disease, cancer, and smoking. So those are the three illnesses that we're going to look at in this module and determine how psychological factors actually affect those and the problems that go along with those. So first off, let's talk about coronary heart disease. And we're going to talk about the A, B's, and D's, not C's, right? So the A, B's, and D's of coronary heart disease. So first off, we'll start out with the A's, and it's the type A behavior pattern that you would see with coronary heart disease. It is a cluster of behaviors involving hostility, competitiveness, time urgency, and feeling driven. Hostility is the key component here. So what we know is the type A men develop coronary heart disease twice as often and suffer significantly more fatal heart attacks than type B men. So if you're a type A personality, you have a lot of hostility, you're very competitive, things have to be done like yesterday, and you feel very driven. Now that may not all seem bad, but if you do that day in and day out, that can actually lead to more significant fatal heart attacks. If you have a type B personality or a type B behavior pattern, that's characterized by individuals who are patient, cooperative, non-competitive, and have a non-aggressive manner. And then type D, D stands for distressed. And so individuals with a type D behavior pattern, that's characterized by insecurity, anxiety, and a negative output. So it puts people at risk for repeated heart attacks. So it looks as though the best one out of the three of these would be a type B behavior pattern, right? That's what you want to look at whenever you're looking at coronary heart disease. Now, let's talk about the psychological aspects of cancer. The emotional responses of cancer patients to their disease affects the course of the cancer. And that definitely goes without speaking, depending on the outlook that you have when you've been diagnosed or when you're living with cancer. So there are psychological therapies that have the potential for improving their quality of life and even sometimes extending their lives. And so that's definitely something that you want to look into because you want to increase the likelihood that you're going to survive and live longer than what cancer would have diagnosed you for living. The next illness that we want to look at is smoking. Now, smoking is the leading preventable cause of death in the United States. It is 100% preventable. You do not have to smoke. But of all the preventable causes of death, smoking is the leading preventable cause of death. Whether or not a person will become a smoker depends in part on their genetics. Social factors also play a role, though, so it's not just genetics. And that doesn't mean that just because you have the genetics, you're definitely going to be a smoker. It may increase the likelihood of becoming a smoker, but it does not mean that you will be a smoker. There are also, as it shows here, social factors involved. Some of those social factors are that it's seen as being cool, right? Your friends are smoking, you want to fit in, you also smoke. You may also be exposed to smoking in the media, whether that is in movies or on TV or in magazine ads. I don't think there's the Marlboro Man anymore, but the Marlboro Man back in the day was a cowboy that just looked very rugged and sexy, and he was always smoking a cigarette, a Marlboro cigarette. That's why they called him the Marlboro Man. Also, sometimes it's treated as a rite of passage. You know, everyone tries smoking at least once, and it's seen as this rite of passage. However, that none of these have to be the case. Now, other than just trying smoking cigarettes, when you actually become addicted, there's a complex relationship that develops among smoking, nicotine levels, and emotion. It's not just this easy relationship. It becomes quite complex. Okay, so let's say that you don't smoke, but you're still getting nicotine. Very popular in the last couple of years is vaping and e-cigarettes. Now, let's talk about the difference between the two. Vaping is when you inhale vapors created by an electronic cigarette. An electronic cigarette, also known as an e-cigarette, is battery-powered, cigarette-shaped devices that deliver nicotine that is vaporized to form a mist. So it's not actually smoking a cigarette, but it is similar to smoking a cigarette. Now, this exponential growth in e-cigarettes is very quite worrisome, right? It has taken off like nothing else. You know, people see it as so much more healthy to vape or to use e-cigarettes than actually smoke a cigarette. And that can be really problematic that so many people are doing it. What we find out with adolescents is that nicotine is harmful to an adolescent brain. So if you start smoking in your adolescence, that's problematic. Again, remember that your brain does not stop developing until you're in your 20s. And so if you start smoking as an adolescent, that nicotine is definitely going to affect brain development. Contaminants of nicotine have led to serious health consequences, such as lung damage and even death. What we found is that young users may be more prone to smoke regular cigarettes in the future, as opposed to e-cigarettes. Now, this figure is figure 1 in module 44. Let me find the right picture of it here. This is at the bottom of page 479 in your textbook. And this shows the percentage of teenagers who have used nicotine vaping products in the last month from 2017 to 2019. And we're looking at 8th graders, 10th graders, and 12th graders. And you can see with each of these, it has increased quite a bit. And our highest is in 2019. And that's across the board. It has increased for 8th graders, it has increased for 10th graders, and it has increased for 12th graders, those who are using vaping products. Now, nicotine or cigarettes or whatever it is you're using, it's an addiction. It is a physiological and a psychological addiction. And so quitting smoking is really difficult to do. Once smoking has become a habit, it's as hard to stop as an addiction to cocaine or heroin. It's just as difficult to quit smoking cigarettes as it is to quit doing heroin or cocaine. The average smoker tries to quit 8 to 10 times before they are actually successful. And even then, they are found many times to relapse and go back to smoking. We have found in research that there are 3 successful approaches to quitting smoking. One of those is nicotine replacement drugs, whether you do lozenges or wear a patch, whatever it is. These have been found to be somewhat successful in having people quit smoking. There's also behavioral strategies. Cognitive behavioral therapy has been found to be successful in getting individuals to quit smoking. And then the third approach that's been successful is changes in societal norms and attitudes toward the habit. Now, this is the last figure in this module, and this is looking at the decline of smoking across 8th, 10th, and 12th graders from 1990 to 2016. And it says, although smoking among teenagers has declined considerably over the past several decades, a significant number still reports smoking regularly. So you can see with each grade there has been this significant decline. However, for 12th graders, you're probably still at 15% who smoke regularly. For 10th graders, you're looking at probably around 5%, maybe 3%. And then still, even for 8th graders, you're not at 0%. There's still a percentage of those individuals who smoke regularly.